How do tumor markers help early cancer detection before symptoms? Imagine catching a problem before it becomes obvious. That's what tumor markers can do in the fight against cancer. These are substances found in blood, urine, or tissues that can signal the presence of cancer cells. They are produced either directly by the tumor or by the body as a response to the tumor. In reproductive cancers like testicular, cervical, or ovarian cancer, tumor markers are especially helpful for early detection. For testicular cancer, certain markers such as alpha-fetoprotein, human chorionic gonadotropin, and lactate dehydrogenase often increase in the blood before any symptoms show up. A simple blood test can measure these levels, giving doctors a chance to identify cancer early. Detecting these markers early can lead to prompt treatment, which improves the chances of a successful outcome. In cervical cancer, there isn't a single blood test for tumor markers like in some other cancers. Instead, screening relies on Pap tests and testing for human papillomavirus, which is a virus linked to most cervical cancers. These tests look for abnormal cell changes or viral presence that can suggest precancerous or early cancerous conditions. Detecting these early changes allows for intervention before the cancer fully develops or spreads. For ovarian cancer, the tumor marker Ca125 is often used. While it's not perfect because it can be elevated in non-cancerous conditions, it can still be useful when combined with other tests like ultrasound or genetic testing. If Ca125 levels are high, especially in women at higher risk, doctors may investigate further to catch the cancer early. Using tumor markers alone isn't enough. They work best when combined with other screening tools like imaging scans or genetic tests. This combined approach increases the likelihood of finding cancer early, when treatment is more effective. It's important to remember that tumor markers are not foolproof. Sometimes they can be elevated in people without cancer, and some cancers may not produce detectable markers at all. That's why doctors interpret these results carefully, considering the whole clinical picture. They often use additional tests to confirm any suspicion raised by tumor markers. In summary, tumor markers help detect cancer early by providing measurable signals that can indicate the presence of cancer before symptoms appear. For reproductive cancers, these markers are valuable tools in screening and early diagnosis, especially when used alongside other tests. Early detection can lead to earlier treatment, better outcomes, and higher survival rates. But always remember, medical decisions should be made with the guidance of healthcare professionals who can interpret these markers in the context of your overall health.